Hello, good afternoon, good morning, good evening. I welcome you all as the current ISAM president to this meeting, as I said earlier on, from the beautiful island of Malta, where I have just completed a successful site visit on behalf of the ISAM community for this year's ISAM Annual Congress. My name is Baldacchino, and I work as a clinician in a busy NHS facility, National Health Service Scotland facility, and an academic with the University of St Andrews in Scotland. The International Society of Addiction Medicine is a global organization with an aggregate membership of around 10,000 clinicians working in the field of addiction medicine. ISAM's ethos is focused around the need to work in multidisciplinary and multi-professional systems of care required to support a sustainable and effective clinical pathway. ISAM's vision is to support and empower a competent, qualified workforce through several evidence-based educational and other training opportunities in order to be able to contribute to providing quality service to individuals with complex needs. ISAM puts social responsibility at the heart of its strategic agenda, with innovation, respect, excellence, professionalism, and diversity as its core values. And this can only be achieved through supporting a capable, competent, and effective medical and other clinically related workforce infrastructure. This will help in delivering improvements to our aspirations to have responsive and accessible treatments and other interventions in all our countries that we represent. The key is not only the awareness and recognition of the work that is being done of each of our organizations, but this meeting is a call to collaboration on educational and other initiatives across boundaries throughout the world. This would allow the synergy of expertise and the broadening of offerings in the field. This unique meeting we are all participating in today with over, I was told, 40 countries contributing is a testament of this vision. I can take the opportunity to thank wholeheartedly the ISAM Regional Council co-chairs, the ISAM regional representatives, the ISAM interest group chairs, and as Hamid said, the team of young professionals making sure that this meeting functions as planned within the time constraints present. Last but not least, a big thank you to all of you, ISAM and non-ISAM affiliated societies who are contributing in spite of the challenges imposed by the different time zones when organizing such a global meeting. Finally, as the eternal optimist, I, on behalf of the ISAM community, welcome you all to consider attending and participating at the ISAM 2022 World Congress, which will be held in Valletta, Malta, between the 4th and the 7th of October. This will take a hybrid format, and the call for registration and abstract submission will be announced soon. Without further ado, I hope you all mentally, but not necessarily physically, enjoy this historic meeting in our own safe bubbles of intellectual reality, feeling much enriched by this experience. Thank you very much.
We have Dr. Greg Bunt.
Okay, thank you, Alex, and thank you for all your support for the Regional Council and developing our international connections throughout the globe. I'm Greg Bunt. I'm the co-chair of the Regional Council, along with my good colleague, Ekhtiari. And I'm going to be talking very briefly about the background of Regional Council and the connections that you can have as ISAM affiliates with your international colleagues throughout the globe in addiction medicine. So the Regional Council has been developed because your voice matters, your needs and your reasons for connecting with the international addiction medicine community matters to the board and the leadership. And so we have now several ISAM affiliate societies. We have ISAM affiliate societies now in about 30 nations and regions, and it's developing. We have, I believe, over 40 representatives today here at the conference talking about their own particular region. But your voice matters, and the mission of ISAM is to advance education, of the identification and diagnosis and treatment and science of addiction medicine, to advance the advocacy, connections with government and professional organizations. We have several regional representatives who are very briefly introduced. And now we have Dr. Nadia El-Gabali, who's over Canada, who was the original founding president. We have the esteemed Mark Gallanter over USA, was on the founding board over the USA. And Mark Potenza and Helena Hansen are temporarily over the Central America and the Caribbean. Dario Gingina Parker over South America, and is planning to have a regional meeting in South America this year. Dr. Sophia Akab over Europe. Dr. Tarek Gawad, the second ISAM president, and hosted a great conference in Egypt over the Mediterranean and Middle East. Dr. Solomon Radame over Sub-Saharan Africa, based in South Africa. And we have in Asia, we have two leaders, Dr. Atul Ambakar from India. We had a great conference in India, and Susuma Higuchi, who's going to be stepping down and passing the torch on over Asia. And then, of course, Shalini Arangiri over the Oceania, Australia, and New Zealand. So for those of you in those respective regions, get in touch with your regional representatives. And we have now many associations. As I say, we are approaching over 30 ISAM official affiliate members. And I encourage you all to become ISAM affiliate organizations. The advantages in terms of continuing education support, connectedness with international and global leaders, and you are leaders in the field that is the priority for health around the globe. Yes, COVID has kind of overcome everything else, but COVID is on the decrease now. But addictive disorders, both the substance-related and the behavioral, have been identified by the UN as the #1 public health problem. So your leadership is important. And so without further ado, and in the interest of time, I'm going to turn it back over. I think this is the last slide I want to show, and I give credit to the next slide, Hamed. I give credit to Hamed Ekhtiari, who put this together with all of the particular representatives that will be speaking today from their particular region. So welcome again, and all of the best. If you have any particular interest or needs, please let us know at the central office and join in with the voice of your international colleagues in advocating and advancing for the addiction medicine diagnosis, treatment, and science. Thank you all.
Thank you very much, Greg. Thank you very much, Alex, for supporting to make this happen. And I'm really delighted to be here today with all colleagues that we have across the world. And thank you very much, everybody, to join us. I mean, I know that there are people who are joining from really bad time zones, but I mean, we try to accommodate the things in a way that would be helpful. And we can have people from different time regions. Right now in Minneapolis, it is 6:10 a.m. in the morning, and I hope that you will have a good day, whatever time is in your part of the world. So what I'm going to talk about is about what we are trying to put together as ISAM Global Expert Network. We know that what we have with addiction is a global problem. So we are talking about something that is happening across the world. And we know that addiction is a dynamic problem, which is changing over time with all the new challenges that we are facing. And we need to have international data. There are significant gaps in the international data in terms of what is really happening across the world. And specifically with the COVID pandemic, we realized that there are lots of needs that we can support each other, and there are lots of kind of things that we can provide support in international community to be able to proceed and provide. We realize that we can kind of put together a series of recommendations and how we might be able to kind of discuss about the challenges that people across the world are facing with COVID pandemic. And this kind of sets of recommendations that we put together has been cited 84 times during the last couple of months. It seems that people across the world are using these recommendations. But when we have been putting those recommendations together, we realized that we need to have a global level data. So we started to put together a global survey with 77 countries. And many people who are already online with us, they have been a part of that global survey. And we asked people about the situation and how they are responding to the COVID pandemic and trying to see how we can share our experiences across the world dealing with the pandemic and how we are providing treatment services or preventive services for people who are suffering from substance use disorder. We put together 2 publications from that global survey that are already online, and my colleagues will provide you with the links to these publications. And these publications, even they have been published just a few months ago, they are being cited and being used as resources across the world in an area that we do not have enough information about how pandemic is reshaping our practice in addiction medicine. But kind of putting these together, we realized that we need to have an infrastructure to be able to run these global surveys, to be able to bring people together and make consensus and collaboration. So we started to think about how we can develop an infrastructure that we call Global Expert Network, or ISAM Global Expert Network, with representatives from over 100 countries around the world, and see how we might be able to collaborate to collect data and decide about policies and provide recommendations for people across the world. So we started to put together a steering committee of people who have been collaborating on the previous surveys. So we already have a list of colleagues that are helping us to develop the protocol and technical details. And we are communicating with different international organizations and also some other granting bodies here in the US to be able to provide specific funds to support this initiative. To be able to provide a scientific infrastructure for running expert elicitation in the global level, we have been running different workshops, different educational programs, different webinars, discussing with people, not only from the field of addiction medicine, but people across other areas of global collaboration, whether if they are from politics, from ecology, from climate change. So we are trying to learn from their experiences in terms of the methodology and technical details to be able to do it in a rigorous scientific way. Even we have started to discuss with different journal editors, I mean, major journals in the field, in terms of, okay, what are the standards that you're expecting us when we kind of provide a global survey data? And we are discussing how we might be able to provide that infrastructure. One of the workshops that we launched with major key players and speakers in the field of global expert elicitation is already online in YouTube as an educational resource for those who are interested to know about the technical details. And we highly recommend those who are interested to global expert elicitation to see those videos to have a better idea about how we are putting together infrastructure for that. But these sort of kind of international expert consensus studies are receiving significant attention from the international kind of science community. This is one of the recent work that we publish in Nature Protocols in terms of how we can bring people together to make a consensus about one specific area in addiction neuroscience. And we are realizing there are many other areas that we can develop these global consensus statements, and we are trying to put these together. And we develop specific kind of infrastructure, specific kind of methodology, and we are working with people in ISAM leadership, with Alex, with many others, Greg, and others who are supporting this idea. And I hope that would be something that we can proceed with over time. Those who are interested to join us, we have different ways of providing support for those who are interested to join us. We have a specific web page in the ISAM website, so I will share that web page with you. Those who are interested to have their younger faculty members and those who are interested to have their students to be involved in these projects, we have a meeting with what we call ISAM-GEN officers, who are the next generation of people who are interested to develop their expertise in this field every Sunday early in the morning in my local time. And those who are interested to join us, we will have the next one in coming Sunday. So those who are interested to join us, they are welcome, and we will kind of post the details about the meeting for those who are interested to joining us. So I hope that would be a starting point for actually making something from all these meetings that we have, and the collaborations and the discussions that we are making in the global level.